Now we'll talk about the new advances, the new principles we have in diathermy, the new principles we have in advanced energy devices. We are still talking about anastomosis drains and diathermy. In this section, we have the advanced energy devices. The section has been divided into 3 sections. In the first part, we'll talk about the bipolar electrosurgery devices. In the second, we'll talk about the harmonic scalpel devices. And in the third part, we'll talk about the combination energy devices. We'll see what these are and how they affect affect the body and how they can be used, and further progressing your surgical skills. So we have image-based surgical devices. These are a novel approach. The image-based surgical devices are very important because they help you to go to your surgical field. They help you to attain perfect surgical output. They also help you to have an idea of what is going around within the body itself under direct vision, so that you might not damage any other organ. So laparoscopic surgery, obviously we know that it's a newer horizon which is being commonly used throughout the world. Laparoscopic surgery usually uses monopolar diathermy, and monopolar diathermy has its own risks. It can cause burns or ebb currents, etc. But you should always be prepared and have a keen eye for that. Now, they facilitate dissection and seal and divide vessels up to 7 millimeter in diameter. So now the newer diathermy vessels, diathermy probes, now what they do, they are better. They facilitate the dissection itself, and they can seal and divide the vessels up to 7 millimeter caliber very easily. So we have bipolar electrosurgery devices, we have harmonic scalpel devices, and we have combination energy devices. So these are the 3 types of devices. Here you can see these are the laparoscopic devices, various probes, stroke Rs, etc. being there. They are being used, they are usually used for various laparoscopic procedures. Now the surgeon needs to be aware of the characteristics of these devices, and the surgeon should have the capacity to understand what is going on with these devices. The surgeon should also understand that these devices are harmful, somewhat harmful to the patient themselves, and they can cause various disasters when the surgeon is not aware of their disastrous consequences. So keeping a keen eye and keeping a high margin for error is very important in your surgical practice. So what the bipolar electrosurgery devices, now the bipolar electrosurgery devices are like forceps. Whatever tissue is between the bipolar devices, only that tissue is being electrocuted or undergoing diathermy. So fusion technology is used in open and laparoscopic surgery. So you amalgamate various technologies and use them in both the open and the closed surgical procedures, the laparoscopic surgical procedures. Now they use both the pressure and energy to create the vessel fusion. So the fusion devices, what do they do? They use pressure and they use energy in the form of electricity and heat, and they cause the fusion of the vessels. They also have a feedback sensing technology that they sense when the fusion has been performed, and they stop using the energy at that point in time. The impedance monitoring is also a function, that is, they can monitor the impedance, and that is a relatively nice function. Now they can seal the vessels up to 7 millimeter in diameter within 2 to 4 seconds. So that is something. So these are very fast devices and can seal vessels up to 7 millimeter diameter in up to 4 seconds, and that helps to prevent any blood loss during your surgery. And with these fusion devices, there's comparatively less production of smoke, so there is less distortion of your view as well. Now bipolar electrosurgical devices, still continuing. Here you can see this is the bipolar lead. So there are 2 prongs of this bipolar lead. Once they're brought together, the current flows through them. Now these contain a permanent seal. So there's a permanent seal in them. They usually use in gynecological procedures because there is extensive bleeding in there, and they're very profound in large vessels. So you do not want to damage them. They're also used in colorectal and urological surgical procedures. They bear 3 times the normal systolic pressure. So the vessels which are sealed with the bipolar electrosurgery devices, they have the tendency to bear a 3 times rise in the systolic pressure, and Ligasure system is an example of a bipolar electrosurgery devices. They can be adjusted for real time. That is a great opportunity because you can adjust the real time differences in them, and that helps. It's a smart device, so it helps you in making your decisions. It ligates the pedicles, it ligates the tissues and lymphatics as well. Now moving on to the harmonic scalpel devices. So harmonic scalpel devices, they actually use the ultrasound technology. So let's see how do they work. They cut tissue and seal them at the same time. They have an ultrasound transducer and a scalpel. So there's a transducer and a scalpel. Now the scalpel, it vibrates at about 20,000 to 50,000 hertz. At this frequency, it affects the hemostasis. It has cutting precision, that it cuts very, very precisely. Now it takes longer to cut and coagulate. One of the drawbacks of using the harmonic scalpel devices is that it takes some time to attain that frequency and finally to maintain that frequency so that the cutting effect might be seen. It takes some time for cutting and coagulation to take place. Now it reduces operative time and it enhances the recovery because there is no production of smoke, and this no production of smoke clears the view. It keeps your view clear, and hence it reduces the operative time. Since there's no charring, there's enhanced recovery as well. Now it is used both in open and in laparoscopic procedures, so it can be useful for both of the type of surgeries. It can seal vessels up to 7 millimeter in diameter. Vessels greater than that cannot be sealed by a harmonic scalpel device. So now we have combination energy devices. These are the devices that use both or multiple other technologies at the same time. So the combination devices, they seal and divide the vessels up to 7 millimeters. Still it is there. It has a seal only mode as well. So combination device can only be used as a seal only product. Now one product is the Thunderbeat or the Olympus, can be seen in the figure. So these are the newer devices that are being developed at the same time. They require specialized teams, specialized equipment, and these specialized teams and specialized equipments need to be operated by their staff in a special way. Now they use the ultrasonic vibration and the bipolar diathermy at the same time, so hence the name, the combination device. They're costly. Usually they are not easy to get. They require a lot of training, a lot of trained staff, and that around the clock for these devices to work. So this was all about this section. We've talked a lot about the advancements in diathermy procedures and the combination devices. I hope you liked and enjoyed this section. For further sections, keep watching sqadia.com.